Every single night, 50 million Americans wake up to use the bathroom. Not once, 2, 3, sometimes 5 times. And here's what nobody tells you at your doctor's office. In 80% of those cases, your bladder is completely healthy. It was never the problem. All those pills, supplements, and herbal blends you've been taking for your prostate or your bladder, they're aimed at the wrong organ entirely. By the end of this video, you're going to understand exactly why you keep waking up, and more importantly, exactly what to do about it tonight. I'm Dr. Adrian Calloway, and this is Advanced Health, the channel where we stop treating symptoms and start understanding the actual mechanics of your body. If you're new here, welcome. And if what I share today helps you, consider subscribing. It genuinely helps this information reach the next person lying awake at 3 a.m. wondering what's wrong with them. Now let me paint a picture, because I'd guess a lot of you are living it. It's 3 a.m. Your apartment or house is completely still. You finally sank into that deep, heavy sleep. The good kind, the kind you don't get enough of. And then the signal comes, faint at first, at the edge of your awareness. You try to roll over. You try to think about something else. But the pressure builds. You throw back the covers, plant your feet on the cold floor, and shuffle to the bathroom half-conscious. You squint against the light. You do what you came to do. You climb back into bed, and sleep is gone. Your mind starts running. Work, bills, the kids. You lie there for half an hour, maybe an hour. You finally drift off, and it happens again. You wake up in the morning heavy-headed and foggy, and you pour coffee into yourself just to function through the day. If that sounds familiar, I want you to know something first. You are not broken, and you are not simply getting older. I hear a version of this story from patients constantly, and almost all of them have already been told the same thing. It's just age. Everybody gets up at night. I need to be direct with you. That is a myth, and it's a harmful one. Getting up at night to urinate is not a normal, unavoidable part of aging. Not at 40, not at 60, not at 80. A well-functioning body is built to get you through the night without interruption. Here's the biology behind that. At night, your brain releases a hormone called antidiuretic hormone, also known as vasopressin. Think of it as a memo sent to your kidneys. Night shift, concentrate the urine, reduce the volume, run on low power. That single hormonal signal is what allows a healthy person to sleep 7 or 8 hours straight without a single trip to the bathroom. When that signal breaks down or gets overridden, it isn't a small inconvenience, it's a diagnosis. In medicine, we call repeated nighttime urination nocturia. 1 trip a night is worth paying attention to. 2 or more is your body waving a flag, and this matters for more than just your sleep schedule. Every time you wake, your heart rate rises, your blood pressure spikes, and you get pulled out of deep sleep. The exact phase where your brain clears out metabolic waste, your neurons repair, and your cardiovascular system genuinely rests. Losing that phase repeatedly, night after night, year after year, is linked to higher rates of high blood pressure, mood disorders, and faster cognitive aging. Some clinical research even suggests the cardiovascular toll of chronic nocturia rivals that of long-term smoking. That's not hyperbole. That's what shows up in the data. Here's where most people go wrong, and where I want to save you months, sometimes years, of frustration. When patients come to me with this complaint, they've almost always already diagnosed themselves. Men are convinced it's their prostate. Women are sure it's menopause or a chronic bladder issue. So they load up on prostate supplements, herbal diuretic teas, cranberry pills bought off a late-night ad, sometimes even antibiotics for infections they don't have. Some restrict water so aggressively they go to bed with a dry mouth and still wake up at 3 a.m. Why? Because they're fighting the symptom, not the source. Think of it like a smoke alarm going off in your house. Most people's instinct is to rip the battery out so the noise stops. But the correct move is to go find the fire. Your bladder is the alarm. It's simply reporting that something else in your body is sending it fluid at the wrong time. In roughly 80% of cases, the bladder itself is doing exactly what it's designed to do, emptying what's been put into it. The real question is, who's filling it up at night? And why? And the answer, for a surprising number of people, traces back to your legs and your heart. Before I explain that mechanism, let me be a responsible physician for a moment, because some symptoms need a doctor's office, not a video. If you notice blood in your urine with no pain at all, dark, reddish-brown urine, or visible clots with nothing hurting, that combination, especially in anyone over 50, needs to be evaluated promptly. It's one of the classic early warning signs that shouldn't be ignored. Likewise, if nighttime bathroom trips are paired with unexplained weight loss and new bone or back pain, that pattern also deserves prompt medical attention. If neither of those applies to you, take a breath. You're very likely dealing with something mechanical and fixable, which is exactly what we're going to walk through. In urology, nighttime urinary issues generally fall into 3 categories, and treating the wrong one can actually make things worse. The first is simply producing too much urine around the clock. You're going frequently day and night, with large volumes each time. This is often driven by high fluid intake or an underlying issue like diabetes, and it needs medical evaluation, not home remedies. The second, and this is the one that affects the majority of people over 50, is what's called nocturnal polyuria. During the day, you're completely normal. You go every 4 or 5 hours, nothing unusual. But the moment you lie down, everything changes. 3 or 4 trips, each one a substantial volume, and in the morning you genuinely can't explain where all that fluid came from. The third category is a bladder capacity problem. Sudden, urgent needs to go, but only a small trickle actually comes out, often caused by prostate enlargement, an overactive bladder, or irritation from stones or infection. Let me tell you about a patient I'll call Robert. 54 years old, the kind of guy who doesn't complain and only sees a doctor when he's truly at the end of his rope. He walked into my office with a folder full of paperwork, a bladder ultrasound, a PSA blood test, a stack of prescriptions. "Doc, it's my prostate, or God forbid something worse. I'm losing my mind." His pattern: one nighttime trip became 2, then 3, then 4 or 5 a night for 6 months straight. He'd bought the marketed prostate blends, tried the herbal remedies, and even cut his water intake drastically. And he was still getting up twice, each time releasing half a liter of urine, despite barely drinking anything all evening. When I looked at his labs, his PSA, the prostate marker, was completely normal. He had only a mild, early-stage prostate enlargement, nowhere near enough to explain what he was experiencing. So I stopped asking about his bladder and started asking about his life. "Any shortness of breath?" "A little, when I climb stairs. But I smoked for 20 years, quit about a year ago." "Do your socks leave a mark on your skin by evening?" "Yes, actually. There's a real dent there." "Doesn't everyone have that?" That's when the picture clicked. I told him to set the prostate pills aside and referred him to a cardiologist and a sleep specialist instead. He looked at me like I'd lost my mind. "What does my heart have to do with my bathroom trips?" The cardiologist found early, quiet heart strain. His heart wasn't circulating his blood volume efficiently during the day, so fluid was pooling in his legs. The sleep specialist found obstructive sleep apnea, which independently disrupts that antidiuretic hormone we talked about earlier and pushes the kidneys into overdrive at night. Robert had spent months treating a leak in the faucet while a pipe was bursting in the basement. Here's the physics, because once you see it, you can't unsee it in your own life. Picture a bottle of water lying on its side versus standing up. The fluid distributes differently depending on gravity. Your body works the same way. For most of the day, you're upright, and gravity pulls blood, lymph, and tissue fluid downward toward your feet and ankles. In a young, healthy circulatory system, strong vein valves and the pumping action of your calf muscles keep that fluid moving back up efficiently. But as we age, or if we're sitting for long stretches at a desk or on a couch, those valves weaken and that muscle pump stops doing its job. Fluid quietly seeps out of the blood vessels into the soft tissue of your lower legs, sometimes up to 1.5 liters of it, completely invisible from the outside except for a faint sock mark. And critically, your kidneys can't filter fluid that isn't circulating in your bloodstream. That stored water is essentially off the books until you lie down. Then comes the evening. Dinner, maybe something salty, then hours sitting with your legs down while fluid keeps accumulating. You turn off the TV and lie flat. Now your legs are level with your heart, gravity releases its grip, and all that stored fluid rushes back into circulation, like an extra liter of fluid entering your bloodstream within the hour. Your heart notices. A hormone called atrial natriuretic peptide, ANP, gets released as your heart's right atrium stretches with the extra volume. Its message to your kidneys is blunt. Get rid of this excess fluid right now. It blocks the hormone that normally retains water, and your kidneys shift into rapid filtration mode. Within an hour of lying down, your bladder fills. You get up, but the leg fluid hasn't finished draining. So 2 hours later, it happens again. That's the entire mechanism behind so-called nocturnal polyuria. And notice, your bladder, your prostate, none of that is actually driving the bus. So how do you check if this applies to you? No scans, no expensive labs, just your own hands. Sit down and expose your shin, the bony front surface of your lower leg with no muscle covering it, about 4 to 6 inches above your ankle. Press your thumb firmly into it and hold for 10 to 15 seconds, then release. If the skin springs right back, you're likely fine. But if there's a visible dent that lingers for several seconds, you've just found a hidden reservoir of fluid that's waiting to flood your kidneys once you lie down. You can pair that with a simple urine diary. On a day off, measure your total output and note how much of it happens after you go to bed versus during the day, including your very first trip in the morning. If more than a third of your daily total is happening at night, that confirms nocturnal polyuria, and it points you towards circulation, not your bladder or prostate. Diet plays a bigger role here than most people expect. Hidden sodium in cheese, cured meats, and packaged foods causes your body to retain water in the evening, then aggressively flush it, along with that sodium, overnight. Evening sugar spikes insulin, which also drives water retention, followed by a rebound flush a few hours later, right as you're falling asleep. And that nightcap drink you thought was helping you sleep? Alcohol suppresses the very hormone that's supposed to slow your kidneys down at night. So while it might sedate you initially, it actually increases overnight urine production and fragments your sleep even further. On the helpful side, raw pumpkin seeds provide magnesium and zinc that relax the bladder's muscular wall and support pelvic floor tissue. A small daily handful can make a real difference. Unsweetened cranberry, not the sugary juice cocktail, contains compounds that reduce chronic irritation in the bladder lining. And enough fiber in your diet keeps your colon from pressing against your bladder and creating false urgency. Robert simply swapped his sausage and cheese dinner for a chicken and vegetable salad and cut out his evening cookies with tea. And that alone eliminated 1 nighttime trip out of 5. Real progress. But diet alone couldn't fully override weakened vein valves and reduced vascular elasticity. That needed a more targeted approach. So here's the protocol I actually walk my patients through, and the one that became the real turning point for Robert. It takes about 5 minutes total spread across your day. In the morning, before coffee, do 30 gentle heel raises. Up onto your toes an inch or two, then let your heels drop with a light thud. This reactivates the tiny valves in your leg veins right from the start of the day, so fluid is less likely to pool by evening. If standing isn't comfortable, lying on your back and gently shaking raised arms and legs for about a minute achieves something similar. During the day, aim to get about 70% of your fluids in before 4 in the afternoon, rather than loading up in the evening. After that, small sips only, enough to stay comfortable, not thirsty. And try removing the salt shaker from the table entirely. Salting only during cooking cuts daily sodium meaningfully without changing what you actually eat. Then, roughly an hour to 90 minutes before bed, do what I call the lazy elevation. Lie on the couch or floor with your legs propped up on a chair, armrest, or against the wall, heels above heart level for 15 to 20 minutes while you read or watch something. This lets gravity push that stored leg fluid back into circulation while you're awake and in control, rather than at 3 a.m. You'll likely feel the urge to go about 30 to 40 minutes later. Go, and you've essentially preempted the middle of the night wake-up. If you have visible swelling, Graduated compression socks worn in the evening, not overnight, can help prevent that pooling in the first place. Finally, once you're in bed, 20 to 30 properly done Kegel exercises, engaging only the pelvic floor, as if stopping the flow of urine with the abdomen and glutes relaxed, help calm an oversensitive bladder over time. Robert was skeptical at first. Legs up the wall. Really? Doc? A week later, he came back and told me, almost in disbelief, that he'd only woken up once that week. A month in, he was sleeping through most nights entirely, and his cardiologist noted his leg swelling had visibly improved. This works because it's built on actual physiology, gravity, hormones, and muscle mechanics, not wishful thinking. And it does require consistency. This isn't a pill you take once and forget. One more thing worth knowing. This pattern becomes more common with age, as vein valves and vascular elasticity naturally decline, which is why it shows up so much more often after 50 than before 40. If that's you, this is worth taking seriously, not shrugging off as just getting older. So here's your plan for tonight. Do the thumb test on your shin right now and see if a pit remains. On your next day off, track how much of your urine output happens after bedtime. Tonight, skip the processed, salty dinner and put the salt shaker away. An hour before bed, elevate your legs for 15 minutes. And once you're settled in, do a proper set of Kegels before you fall asleep. And if that thumb test does leave a lasting dent, or you're noticing shortness of breath on stairs or sock marks by evening, my honest advice is to see a cardiologist or vascular specialist before a urologist. That's the path most likely to actually solve this. Your bladder isn't your enemy. It's a signal light, faithfully reporting on something happening elsewhere in your body. Once you understand what's really driving it, you don't have to just live with it. You can actually fix it. If this helped you understand something about your own nights a little better, I'd genuinely appreciate a like and a subscribe. It helps this reach the next person quietly suffering through the same thing, and it lets me keep making videos like this one. Drop a comment and let me know what's clicked for you tonight, and I'll see you in the next video.